Good afternoon, everyone. This is Saro Arakelian, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and update. So what are the SGLT2 inhibitors? In this video, I'll be combining all the SGLT2 inhibitor medications, which is about 5 of them, in one presentation in a summary format for you to see all of them together, and in a table that I created to compare them all together for you to see the differences. So let's get into the SGLT2 inhibitors. They're called sodium glucose cotransporter 2 inhibitors. There's a list of 5 of them: Canagliflozin or Invokana, Dapagliflozin or Farxiga, Empagliflozin or Jardiance, Ertugliflozin or Steglatro, and Bexagliflozin or Brenzavvy. These are the 5 SGLT2 inhibitors approved in the US market by FDA. As I said, they're called sodium glucose cotransporter 2 inhibitors. Sodium glucose cotransporter 2 inhibitors are a class of medications used to treat type 2 diabetes and heart failure. They work by inhibiting the reabsorption of the glucose and sodium in the kidneys, leading to increased excretion of glucose in the urine. Also, SGLT2 inhibitors also promote the excretion of the sodium with the glucose in the urine, leading to decrease in fluid volume. This reduces the overload on the heart and improves cardiac output. So this is how SGLT2 inhibitors work on improving on blood glucose levels for diabetic patients and decrease volume overload for heart failure patients. Here's a table I created for you to see all 5 of them in one place: Invokana, Farxiga, Jardiance, Steglatro, Brenzavvy. Their dosage is available. Invokana comes in 100 and 300 milligram, Farxiga 5 and 10 milligram, Jardiance 10 25 milligram, Steglatro 5 and 50 milligram, and Brenzavvy 20 milligram. As far as the indications go, I've included for each one of them. Invokana, obviously one of the older one: diabetes, reduced risk of CV events, reduce the risk of end-stage kidney disease. Farxiga for diabetes and reduction in the risk of hospitalization for heart failure. Jardiance, diabetes, reduction in the hospitalization for heart failure, reduction in the end-stage risk of end-stage kidney disease, and a reduction in the risk of CV events. Steglatro and the Brenzavvy, the new ones in the market, are just approved for diabetes per package insert. I've also included the kidney function limits for each of them that are not recommended below, which mentioned over here. So Invokana not recommended for less than 30 GFR, Farxiga less than 45, Jardiance again less than 30 GFR, Steglatro for less than 45, and Brenzavvy less than 30. They're not recommended to be used for those patients. Again, this is a list of SGLT2 inhibitors: Canagliflozin, Invokana, Dapagliflozin, Farxiga, Empagliflozin, Jardiance, Ertugliflozin, Steglatro, and Bexagliflozin for Brenzavvy. For more detailed information on these drugs, make sure to comment on the video or with your questions, or you can access the package insert for each one of them for more detailed information on the dosing, side effects, cautions, and precautions on these medications. Hope you enjoyed this video. As always, stay safe and take your medications.